Good morning, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to our fourth edition of Not Just a Dog, Honoring Hope in Healing, recognizing the caregivers to celebrate National Doctors' Day. And to celebrate this day, we have with us Dr. M. Unnikrishnan, Vascular Surgeon, HOD, and Senior Consultant of SUT Pattom Hospital. Welcome to our show, sir, and congratulations on National Doctors' Day.
Thank you very much.
Thank you, sir. So this year we are celebrating the fourth edition of Not Just a Dog, which is an extraordinary celebration dedicated to showcasing the remarkable efforts of our doctors and expressing our heartfelt appreciation for their selfless service. So, with this
Thank you.
campaign, we aim to celebrate doctors beyond their profession. We want to highlight, celebrate the person who is on their toes on providing the service to the patient. Who is he beyond the medical profession? And what are their likings, hobbies, and interests in life?
Thank you. That
So,
will be nice.
yes, sir. I would like to know what inspired you to pursue a career in medicine and how do you balance your professional life with your personal life?
Yeah. Uh, to answer your question, in fact, when I finished school, I used to like maths and science, so I thought I'll become an engineer. But my father said, "No way, you are not going to be an engineer." His experience with engineers were not good, so he said, "You become a doctor. You can help people. You can help people selflessly." Which I am able to keep it because I passed out my MBBS MS from JIPMA, then came to Sri Chitra Institute, all places, both places non-practicing. Now I am in SUT, continuing the similar kind of work culture and attitude towards patient. So that is
That's
the
great,
reason.
sir.
Actually,
So,
my dad is responsible for the decision, not really me.
so parents paves our way. That is true.
Yeah. Then the second part of the question was I forgot.
So, how do you balance your personal and professional life?
Yeah. To be frank with you, that balancing has not been very good because I used to devote mostly 35 years of work in Sri Chitra. It's been quite demanding. You are there 8 o'clock. Most of the day you leave by 6 to 7 p.m. So my wife was understanding enough, smart enough to manage me, both the kids and the home from the beginning. Still she does.
That's great. So, you have a support of great partner and family.
Yeah.
So, can you share a hobby or interest that you're passionate about outside your medical practice?
Yeah, earlier in my practice, we used to play some shuttle or tennis, but then we thought it is not being adjustable for my work. So currently, last 10-15 years, it's listening to music, which eases me out. All kinds of music like ghazals, even like, my current hero about music is Avirbhav of, that superstar singer. I think what a boy. 7-year-old sings like a 50, 60-year-old, people clapping him over, and fantastic. I think he is a reincarnation of a big musician in the past. Okay.
That's great, sir. And I agree that the talent is not based on age, and the examples are in front of us. We can see that, like you mentioned, one of the superstar singer.
Right.
Yeah. Sir, what advice would you like to give to fellow doctors like you, like listening music and that de-stresses you? So, any advice you would like to give to your fellow doctors about pursuing passion outside their profession that can help them to de-stress, relax, and they are there's this thing rejuvenated for their work.
Yeah, that's a good question because medicine can be very demanding at times, sometimes more, sometimes less. And so it is necessary to have a hobby which keeps you a little detensified and comfortable. So many of this, like in Kerala, the children learn to dance, learn to sing, or learn to play. So they have a hobby, and I think they should pursue to not to the level of their profession, at least an hour if they can spend every day, and that will be very helpful. Fortunately, I find almost more than 1 or 2 hours whenever I can. I sit in front of the TV or my laptop listening to music. That takes me, I am somewhere well above the ground, but not to the clouds.
The most important part is that if you enjoy that, then the level of expertise doesn't matter if you're enjoying that
Right.
activity.
Absolutely, absolutely.
So, lastly, you are into medical profession. You have daily interaction with patients. So that is one of your main job to connect with them, to have to build that trust, and so that you can it can help you in better diagnosis. So, what do
Yeah.
you enjoy most about interacting with your patients on a personal level, and how does this enhance your medical practice?
Again, another great question. I think, when a patient comes to me, whether for a consultation for surgery, she is doing, she is not doing any favor. I mean, she is doing the favor to me, and I am not doing the favor to her. That is my attitude, because I am glad they come to me, because I have the opportunity, and whatever I am today, it's because of the patient's trust. And there, so I always spend time. I ask them, "You're from Calicut. Are you in the town, or are you in the village setting? Which is the play?" I know few names. I'll ask her, "Is it near the playground or any personnel?" And it has helped me, because especially as a surgeon, see, surgery is a profession. At times it can be a mistake ridden path when we take it. You cannot say that 100 out of 100 every surgery goes well, due to many factors. But what we can limit is unforced errors can be limited, and keep a little less confidence than read it, so that you attend to your work for the day. And so to that extent, I keep my mobile numbers in the discharge summary, give to the patient, and I want them to call me once a week or once in 2 weeks. Sometimes I call them to know, out of my anxiety, sometimes want to know a major surgery, how they are feeling. So that way it has really helped. The one patient I had operated 15 years ago, that patient's brother brought his daughter. They have gone to 6, 7 doctors, Mangalore, Calicut, because he remembered me, and she had some neuro problem. But that they came from Kannur or Mangalapuram, that distance. So I feel that it is from patients mouth to mouth you get the best. And what I feel is that the what we do good, what goes around will come back to me, which is really done, because even the government of India has given me the Dr. B.C. Roy Award in 2016, which I feel it's only I'm the fourth or fifth member in Kerala state from 1966 happening. 62 when B.C. Roy died, and the first person so far to get this from B.C. Roy Award at Sri Chitra Institute, big institute. So I was just fortunate, because I thought, it's our duty to help the patient. It is my responsibility. And when a patient comes with a problem, it's no more his own problem. It's partly my problem. I am a surgeon, I'm a physician, I'm an advocate for that patient. Yeah.
That's great, sir. You explained this in a very beautiful way, and you said it right. It is the mouth to mouth. It's the relation of doctor and patient, the trust which builds it, the trust, the relation which expands. He got treated from you 15 years back, and now he still remembers you. That's why he brought his daughter to you, so that he has that trust over you that you are the best doctor to treat her. And despite going to any hospital, any places available, he had that trust with you. That's why he came back. And the attitude you have, that you are because of your patients, they are doing a favor, that is great, sir. And patience, because of this attitude, I believe you have reached to this heights, you have achieved so many of things. And patients have this comfortableness with you, and that's why they are very happy when they come to you, and That's a great part you've just explained
Thank
to
you,
us.
Simran. Thank you, Simran. And I think on this day of July 1st, when all over India we celebrate Doctors' Day, I remember Professor Dr. Bridan Chandra Roy, who is a FRCS and MRCP, a physician and a surgeon in 1909. And he has been the friend and treating doctor to Mahatma Gandhi and Jawaharlal Nehru. He has been the chief minister college district itself, and he was naturally the government of India honored him with Bharat Ratna in 61, and on 1st July 1962 he left he left for heavenly abode. He has been his birthday is 1st July, that will be 1882. So 80th year after on the birthday, that is his the day he died, and I think most appropriate to keep July 1st as the Doctor's Day. All my compliments, good wishes to all the doctors in our country, and I'm proud to be a doctor. I'm proud to be a surgeon. I'm proud to belong to first Sri Chitra, earlier Jipma Pondicherry, and now a magnificent institute with very good colleagues and a great leader, SUT Hospital Pattom. And thank you very much, Simran, for giving me this time.
Thank you so much, sir, for taking out time out of your busy schedule and coming to the show. And it's an honor to have you with us on this special occasion. And whatever gratitude we offer to you, that is less to you and to all the doctors, the service they're doing to us and to all the patients they come to doctors. Thank you so much for your selfless service, sir.
Thank you. Thank you very much. Thank you.
Thanks
Thank
a
you
lot.
for having me here today.